Welcome to British Biomedicine Institute. Today we will explore sterile techniques and radiation protection and radiodiagnosis. Aseptic technique can be applied in any clinical setting. Pathogens may introduce infection to the patient through contact with the environment, personnel, or equipment. All patients are potentially vulnerable to infection, although certain situations further increase vulnerability, such as extensive burns or immune disorders that disturb the body's natural defenses. Operators must understand the risk-to-benefit ratio of each fluoroscopic procedure and consider alternatives or ways to reduce those. They should carefully review anatomic and pathologic findings from previous examinations to avoid unnecessary steps and reduce procedure time and radiation exposure and identify in advance views most useful for the area of interest. In healthcare settings, hand washing can prevent potentially fatal infections from spreading from patient to patient and from patient to healthcare worker and vice versa. Personnel should always wear properly fitting protective garments, report suspected defects immediately, and submit defective equipment for further evaluation. Mobile shields should be prepared and arranged at the beginning of every procedure in anticipation of the distribution of scatter radiation. Passive shields should be used over and under the table. Personnel should be empowered to point out vulnerabilities and request additional shielding. Any medical procedure that involves penetration of body tissues, an invasive procedure, requires the use of surgical aseptic technique. This includes major and minor surgical procedures, administration of parenteral medications, invasive imaging procedures, catheterization of the urinary bladder, tracheostomy care, and dressing changes. Skin preparation, including scrubbing and, at times, hair removal, precedes invasive procedures. This prevents contamination of the operative site, thereby reducing the chances of infection. The radiographer may be responsible for the skin preparation in his department and must learn to perform this procedure effectively. The radiographer will be required to perform diagnostic radiography in the operating room where they must work without contaminating the sterile fields. Without an understanding of surgical asepsis, this would not be possible. Surgical asepsis is also routinely practiced in the special procedures areas of the imaging department. The radiographer must be able to recognize breaches in aseptic technique and be able to remedy the problem quickly. If contamination is unrecognized, infection may result. Calamation reduces the dose to the patient and operator and improves image contrast. The staff should exit the room or increase their distance from the patient during digital subtraction angiography and cone beam CT scan. A power injector should be prepared and used whenever possible. The operator should understand the role that automatic exposure control plays in determining image quality and dose. All unnecessary objects should be removed from the path of the primary beam, including contrast, syringes, clamps, and shields. Operators should avoid exposing their hands to the radiation field. Qualified personnel under the direction of a medical physicist perform acceptance tests on all imaging systems and personal protective devices. The acceptance tests include image quality, radiation output, automatic exposure, control operation, and visual inspection of personal protective devices for physical imperfections. Radiographic, not fluoroscopic, imaging of the aprons should be performed if a device is suspected of having defects. After these initial acceptance tests, medical physicists supervise the annual performance of routine quality control tests of the devices. Both geometric and electronic magnification result in increased patient dose, so magnification should be used only when it will improve efficiency. Solid-state detectors may allow electronic magnification with less dose increase than with image intensifiers. Thank you for showing interest in British Biomedicine Institute Skilled Nano Degree Program. Hope you have gained a lot of clinical information through this presentation. Please share, like, and subscribe. British Biomedicine Institute channel. Good luck.